how are you?
Good. My name is Brittany. I'm a nursing student here at Kilgore College. I'm just going to do an assessment on you today. Are you okay with that?
Yes, ma'am.
All right. Can I get your name and date of birth, please?
Anna Jones, 2888.
All right. Awesome. Anna, do you have any allergies?
No.
None? Are you in any pain today?
No.
All right. If I was to give you at a scale 0 to 10, what would it be?
0.
0. All right. So I'm going to start out with some vitals. Are you okay if I go ahead and do it on your right arm?
Sure.
Do you know what your baseline is?
I'm usually pretty normal.
Okay. So what brings you in today?
Just here for a checkup.
Do you know what today's date is?
The 8th?
No.
The 7th?
No.
Is it the 11th?
It is the 11th. Correct. Do you know where you're at?
I do. Kilgore College.
All right. Perfect. Were 110 over 80. Anna, do you know your height and your weight?
5'1", 171.
Perfect. All right, put this on your finger. And if you don't mind, open it up for me. Perfect. Your temp is 98.7. And your oxygen is 97 at room air. I'm gonna check your pulse. Okay, so your respiration is 12, and then your heart rate is, sorry, I have to do math, it is 82.
Okay.
Alright, so I'm just going to start off with inspecting your scalp, and with this head to toe, we literally are going to start from the head and go all the way down to the
Okay.
toe. And I'm going to tell you each step as we go. So first, I'm just inspecting. Okay, are you good if I go ahead?
Yes.
Any tenderness, soreness?
No.
No? Okay. So now I'm checking your sinuses. Any tenderness in that?
No.
Okay. So I'm gonna have you look up and I'm gonna check. Okay, and then if you will open your mouth and stick your tongue out. Perfect. Okay, can you take your finger and go, and on the other side? Perfect. Okay, so I'm gonna go ahead and I'm gonna shine, actually I'm gonna do your ears first.
Okay.
Okay, and since I'm on this side, I'm gonna do a whisper test. If you'll cover the opposite ear.
Dog, apple, car.
I'm gonna inspect this one first. Okay. Cover that ear. Perfect. We're gonna do
Blue elephant tree.
perfect. Okay, so now I'm gonna shine a light in your eyes. Well, let me check your eyes. Look at me. Okay. You'll just keep looking at my nose. Okay. So I'm gonna have you look at my pen and then the wall. So pen, wall, pen, wall, pen. Perfect. And then same thing, this time I'm just gonna have you follow my pen, okay?
Okay.
Alright, so I'm gonna have you look at the wall and then let me know when you can no longer see my pen.
No. No.
Okay. Go back over here. So now I'm going to listen to your lungs, if you don't mind sitting up for me.
Sure.
And did I already ask you your height and your weight?
Yes, 5'1", 171.
And have you had a cough recently or anything?
No.
History of smoking?
No.
Okay. So every time my stethoscope hits your back, if you'll please take a deep breath in and then exhale it when I move.
Okay.
Okay, you can move back. So I'm just inspecting. All right. If you'll move your hair to the side. I'm gonna go ahead and listen to your lung, or to your heart.
Okay.
Okay. Just gonna palpate. Okay, and then one thing I didn't do, I didn't check your neck, so if I'm gonna have you look to the window, and then look back this way, and then look straight ahead, if you look up at the ceiling, and then down, okay, look straight ahead again, and then if you can tilt your head to your shoulder, okay, and then the other side, okay. Perfect, alright, if you'll push against my hand, okay, and then push against. Straight shoulders, awesome. Okay, so now I'm gonna go ahead and I'm going to do, I'm gonna listen to your abdomen and inspect it.
Okay.
Have you had a bowel movement here recently?
Yesterday.
Yesterday? Do you go daily?
Yes.
And do you have any urinary issues?
No.
I'm gonna raise you up. I'm just gonna listen first.
Okay.
So I'm just gonna percuss. So next I'm gonna palpate, let me know if there's any tenderness, okay?
Okay.
Any tenderness?
No.
Alright, so I'm gonna go ahead and I'm gonna sit you back up. So next I'm gonna be checking your range of motion. I'm just gonna have you do a couple movements if you'll mirror me, okay?
Okay.
Alright, so we're gonna start out with your movements. So alright, and then if you will squeeze my hands. Okay, and then I'm gonna check. Just checking your capillary refills. Okay. Perfect. I'm gonna take your socks off. Get this last pulse. Checking for any edema. gonna check your strength down here. If you don't mind, point your toes up at the ceiling. All right, push against my hands, and then pull. Perfect. And if you don't mind, raising this leg up, and then this leg. Okay, and then can you bend this leg? And bend this one? Perfect. Put your socks back on, because it's cold in here.
I could have done that, thank you.
It's my job. Okay, so, looks like your range of motion is good and your strength is good. Is there anything else I can do for you?
No, I think I'm good.
No questions?
No.
Alright, just lower your bed. Here's your call light if you need it. Alright, today I have Anna in for a routine appointment. We did a head to toe assessment on her, and we also checked her range of motion while she was here. Overall, her hygiene was good. Her nutrition was also good. Her skin is appropriate to her ethnicity. When doing her head, there was no lumps, bumps, or lesions noted. Her perla was there. Her pupil size was 3 millimeters. Structure and all that was normal. Ears, we did the whisper test, and on both sides it was bilateral, 3 out of 3. Her nose was, or her nasal was patent. Her mouth was moist and pink. And then when we were listening to her lungs during the inspection, there was no abnormalities noted. Breath sounds were audible in all lobes. During the cardiac, I noted S1 and S2 were audible, and there was no abnormality found, no heart murmur, nothing of that. When doing the abdomen, patient stated that there was no tenderness, normoactive bowel sounds. When doing her upper and lower range of motion, they all were intact, no resistance at all. Strength test and upper and lower were strong. All palpable pulses were 2+ and even. I also checked her went blank, jugular vein, and they also were 2+, and no JVD was noted. And I hope that was it. Thanks.